We're going to talk about anesthesia with regards to the dental patient specifically. There are some pretty significant differences that I want to talk about and give you some insight into how we do our anesthesia protocols with our particular patients, being a dentistry only practice. And I know a lot of you have been doing the anesthesia probably for a long time. Maybe some of you are new to anesthesia, but there are certain things that really have to be done in the dentistry practice. And some of you may already be doing these. Some may need to maybe step up that standard of care a little bit in order to accomplish anesthesia as effectively and as safely as possible. And there are significant differences between a dental patient anesthetic event versus, say, a spay or a neuter in general practice. There's differences not only in the patient themselves, the procedure, but what we're doing to that patient. And we've got to be very, very careful in the dentistry service in order to make it as positive not only for the patient but for the client as well. If anything is negative or doesn't go well, or the patient is painful or doesn't recover well, it's very, very unlikely that the client is going to proceed with another dental procedure. And with dentistry, unfortunately, it's one of those cases where it's not something that we do once and we're done. Periodontal disease especially, which is primarily what you're going to be seeing in your general practices, is periodontal disease. And it's something that has to be maintained. We need to do these procedures. There's some patients in our service that we see every 4 months because there's still teeth left that are that require treatment, cleaning, periodontal therapy every time we see these patients. And if we go beyond that 4-month time frame, then that periodontal disease starts to progress. We get more bone loss, and these clients are really, really adamant about not having any more teeth extracted. A lot of times they may only have the canines left. They may only have a few teeth, but they really want to preserve what teeth they have in there, and that's certainly doable. But it's those instances where we need to see these patients and they have to be anesthetized every time we see them, obviously, so that we can evaluate and treat as needed. And if the anesthesia doesn't go well, if there's any question at all as to how things proceed, it's very, very difficult to get that kind of compliance in the future. So hopefully this discussion is going to kind of help you out with that and move you toward a standard of care that you can adopt and implement specifically for your dental patients. And this is not something that you may have to do for all of your patients, but specifically for your dental patients.